Good afternoon, and welcome to the City Club of Cleveland. I'm Karen Allport, a proud member of the City Club's Board of Directors. It's my pleasure to introduce today's speaker, Dr. David Michaels, Assistant Secretary of Labor for Occupational Safety and Health. Today is Workers' Memorial Day, a day to honor those workers who have died on the job, to acknowledge the grievous suffering experienced by families and communities, and to recommit to the fight for safe and healthful workplaces for all. It is also the day the Occupational Safety and Health Administration, most commonly known as OSHA, was established in 1971. Before OSHA's creation, an estimated 14,000 workers were killed on the job every year. Workplace fatality rates have been reduced by more than 66%, and occupational injury and illness rates have declined by 67%. At the same time, U.S. employment has almost doubled. Despite these advances, workers are still at risk of injury and death. According to the U.S. Bureau of Labor Statistics, nearly 4 million workplace injuries and illnesses were reported in the U.S. Right here in Ohio, more than 122,000 occupational injuries and illnesses were reported in 2013. More than 4,000 workers still die on the job each year. Workplaces are safer, but are they safe enough? What can we do to further protect our workers, especially Hispanic and immigrant workers, who are at a much greater risk for injury and death? Our speaker today will shed some light on these issues. Appointed by President Barack Obama and unanimously confirmed by the United States Senate, Dr. David Michaels became the 12th Assistant Secretary of Labor for Occupational Safety and Health in December 2009. As the longest-serving Assistant Secretary in OSHA's history, he has worked to strengthen the agency's enforcement in high-hazard industries, promote common-sense worker protection programs and standards, expand compliance assistance provided to small employers, improve OSHA's whistleblower protection program, and increase outreach to vulnerable populations who are at greatest risk for work-related injury and illness. Dr. Michaels is an epidemiologist. I knew I was going to stumble on that one. Currently on leave from his position as Professor of Environmental and Occupational Health at the George Washington University School of Public Health. He is the author of studies examining the health of construction workers, printers, bus drivers, and other occupations, as well as of numerous publications on science and regulatory policy. From 1998 to 2001, Dr. Michaels served as Assistant Secretary of Energy for Environment, Safety, and Health. In that position, he was the chief architect of the Energy Employees Occupational Illness Compensation Program, the historic initiative to compensate nuclear weapons workers who contracted occupational illnesses as a result of exposure to radiation, beryllium, and other hazards. The program has provided more than $10 billion in compensation to sick workers and the families of deceased workers. He is a graduate of the City College of New York and holds a Master of Public Health and Ph.D. from Columbia University. Ladies and gentlemen, members and friends of the City Club, it is my pleasure to introduce today's speaker, Dr. David Michaels.
I don't need this, right? No. Good. Well, thank you, Karen. Good afternoon to all of you. It's really a great honor and a pleasure to be here at the City Club of Cleveland with you. Let me begin with some thanks. First, Gail Grusser, Joe Ventura, and John Morris from the Mid-America Education Center for arranging today's events. President Tim Berga of the Ohio AFL-CIO, and Harriet Applegate from the North Shore AFL-CIO for supporting this event. Terry Joyce from the Cleveland Building Trades Council. And I want to introduce you to some people you should know. Put down the phone for a minute. Howie Eberts, Kim Nelson are the area directors for OSHA for Cleveland and Toledo, so this whole area. And they're people, if you don't know them, you should know them, because OSHA is your ally in getting to safe workplaces, and they're really the key people you should know. And Nick Walters, I don't know, I'm having trouble with my names today, from Chicago. He's in charge of our region. But mostly I really want to thank all of you, not just for coming out, but you wouldn't be here unless you were already committed to workplace safety and the work that you've done. Employers are here, unions are here, a big crew of people from the Ohio State Bureau of Workers' Compensation who are involved in helping small businesses address safety and health hazards. We're working together. We have a long way to go, but we're doing good work together. On Workers' Memorial Day, we remember and honor working men and women who lost their lives on the job. We remember the coworkers, friends, and families of these fallen workers. And on this day, we recommit ourselves to our mission. At the end of every workday, every worker should be able to go home safely. It's easy to say, but there's a whole lot of work that we need to do. We know that workplace fatalities, workplace injuries, illnesses, they are destroyers of the American dream. Workers who are injured on the job, they never really, they're never made whole. They never come back. They can't live their lives as fully as they were before those serious injuries. You heard some of the statistics before from Karen. The Bureau of Labor Statistics estimates that, well, first they tell us, they don't estimate, that 4,500 workers were killed on the job last year. That's 12 a day. Now, that's far better than we were doing 45 years ago when the OSHA law began, when there were 37 deaths every day in the American workplace. Now, with a workforce twice as large, we're down to 12 fatalities a day, but 12 fatalities a day is really unacceptable. How is that going on in this country? It shouldn't be allowed. But more than just the fatalities, there's this invisible epidemic going on. It's invisible not because we can't see it, but because I think on some level, there's no national acknowledgement that this is going on. And the statistics are really sobering. Employers record on their OSHA logs, the log where they keep track of injuries in their own workplaces, record more than 3 million injuries a year. You heard that, 120,000 or so in Ohio alone last year. And those are serious injuries, injuries beyond first aid. It doesn't include illnesses because most illnesses never get diagnosed in a way that employers even know about them. But for injuries alone, more than 3 million a year, and it turns out that's an underestimate, because when the Bureau of Labor Statistics paid various researchers to go into workers' compensation programs and emergency rooms, say, how many people are you finding who have workplace injuries, and then comparing the two, BLS will tell you now that they're underestimating the number of injuries that are occurring, and maybe it's a 40 to 70% underestimate. So there could be 5 million, 6 million injuries occurring every year among American workers. 6 million, 5 million, whatever it is, it's an unbelievably high number. Yet that doesn't make front page news. That's never discussed. We have this idea that workplace events, workplace incidents, are acceptable. We talk about, well, that's a hazard of the job. If someone's hurt on the job, well, that came with the job. When someone is killed on the job, the police investigate, and I see the articles every day, and what do the police say? It was an accident. But there are no workplace fatalities. There are no workplace injuries. They're just random events. That, random meaning you're walking along and you're hit by a meteorite, or there's something that is out of your control. But workplace injuries are predictable and they're preventable. There's nothing random about them. There's nothing accidental in that sense. They're accidental in that they're not planned, or no one is, they're not intentional, but they're certainly not random, and to call them accidents sort of degrades them in some ways. These injuries are all preventable, and we can do something about them. The toll on all of us, on the nation, is huge. There's a toll on workers who are injured, on their families, on their coworkers, on their employers, and we could discuss that a little bit. On the toll of the employers is actually quite large. And there's a toll on the country. Workplace injuries force working families out of the middle class. And for low-wage workers, some of the most vulnerable workers, workplace injuries are the reason they never get into the middle class. It crushes them. It creates a trap which leaves them less able to save for the future and make the investment in education, other skills that you need for advancement. Workplace injuries crush the American dream. Now, most of us think when a worker is injured, they get workers' compensation, and that's sort of the end of it. That's the historic bargain that we've had for over 100 years. The basis of workers' compensation is workers cannot sue their employer if they're injured on the job. Instead, they're given full medical benefits, first dollar coverage, and they're made whole in terms of their wages. That's sadly not really the case anymore. And I think we're fortunate in Ohio, there's actually a pretty good workers' compensation system. But across the country, we see a race to the bottom. We see state legislature after state legislature competing to lower benefits because they think that's a better way to attract employers either to move to the state or not to leave the state. To the point where 2 states, Texas and Oklahoma, have actually just recently, well, Oklahoma very recently, passed legislation making workers' compensation voluntary, or letting the employer actually choose what the benefit levels are. As long as it's so difficult for workers to get workers' compensation, given the choice, if you have any other choice, you go to another system. So if a worker has health insurance, and the choice is their own health insurance versus going onto the workers' comp system, they often will choose their own health insurance, even if it means it will cost them more out of pocket, but they can do better as a result. So the studies show us now that workers' compensation actually cover about 21% of the actual costs of workplace injuries and illnesses right now, 21%. The majority of costs are picked up by whom? Well, workers and their families. More than 60%, probably 63%, are paid by workers and their families. In other words, the lowered wages they get, the other costs that they have to pick up, come directly out of workers' pockets. The remainder is paid by, not surprisingly, us, taxpayers. When an injured worker doesn't get on workers' compensation, or they're on workers' compensation for only a limited amount of time, but they have a long-term disability, where do they end up? They end up on Social Security disability, Medicare or Medicaid, depending on their situation. And that means the taxpayer is subsidizing dangerous employers. Because if employers picked up the true costs of workplace injuries, then the taxpayer wouldn't have to pick those costs up. But right now, because taxpayers and the families pick those up, there's very little incentive to prevent those injuries from occurring. And so it really does mean that all of us are subsidizing dangerous employers. For occupational illness, the challenge is even greater. Because so many illnesses aren't diagnosed till later, and many workplace illnesses are never identified as such, when a worker develops cancer as a result of exposure to asbestos or silica, the physician wants to treat the cancer, but doesn't care much whether it was caused by asbestos or silica or some other chemical or whatever it is. Those workers rarely get into workers' compensation. The estimates are about 97% of workplace illnesses are uncompensated. And of course, for those workers, eventually, who does pick up the cost? Those are public programs, Medicare, Medicaid, veterans benefits. It's far more easy to get those benefits than through workers' compensation. So that's the basic problem we're facing. By the way, I've written about this in some detail. OSHA just issued a report, Adding Inequality to Injury, the Cost of Failing to Protect Workers on the Job. And you can get it from our website. But it really tries to go through this issue, which is really the contribution of workplace injuries to income inequality. But it gets in some ways a little more complicated for us now because the structure of work is changing in the United States today. And what we saw when many of us began our work, and certainly when the OSHA law was passed, is most workers worked for the employer whose name was on the door. And a large portion of the workforce was unionized. And it was pretty straightforward to figure out how do we make sure to get safety into this workplace in a way that really protects workers. And as a result of that work, OSHA and its partners, all of you in industry and labor, were successful in driving injury rates down and fatality rates down. But as I said, the workplace is changing. And right now, if you go into almost any manufacturing site in northern Ohio or anywhere around the country, you will see workers from many employers working at that work site. And that's true in construction sites as well, though of course construction has always dealt with multiple employers in the same site. But the situation is getting very different right now. There are three parts to this. By having many employers in the same place, it is absolutely necessary to have not just communication, but collaboration between those employers to make sure workers are safe. But that's rarely the first thing on the minds of the employers who get involved in this. And groups will come in, and they'll come in for a certain job. They won't be well trained. At one time, I think some of the large employers really recognize this, but we see over and over again contractors coming into facilities that are not well trained and there's not good coordination. Within many sites, and this is particularly true of construction sites, I think many people here are involved in the building trades, we see pervasive misclassification of employees. We'll go to a site and we'll be told by the employer there, the contractor, that all of those people working for him are independent contractors. And it's nonsense. They're employees. You can't claim that a roofing company can't claim that the 10 people working for them on the roof, they're each independent contractors. We don't permit that. It's against the law. If we see that, we will issue citations anyway against the employer, the real employer, and we'll call the Wage and Hour Division. But more importantly, those workers have very little protection. If they're injured on the job, what happens to them? Their employer hasn't put in workers' compensation insurance premiums. They're on their own. And that misclassification is, as I said, pervasive. There was just a study done by the McClatchy News Service that said about a third of the workers, construction workers in some states, are misclassified as independent contractors. So we think that's a huge problem. And we think that's a problem that's making the injury inequality problem much worse. And then on top of that is the growing use of temporary employees. And this is something that happens, it's a growing trend in the United States. It probably will decrease a little bit now as the economy picks up when people get more permanent jobs. But we've seen right now there are about 3 million workers in the United States who work for staffing agencies who are placed in host employers. Now, we've seen case after case where a temporary worker is at increased risk and pays the price. And the story that really brought this to my attention was a young man named Day Davis. I think he was 21 or 22-year-old young man in Jacksonville, Florida. He was a graduate of the Labor Department's Job Corps program, which means he went through a program to give him the skills to be able to get a job. He hadn't ever worked a paid job in his life, but he was eager to. He contacted a staffing agency, which sent him to the Bacardi Bottling Corporation in Jacksonville. He was very excited about the job. You can imagine. He finally got a job. He was told to show up the next day at 2 o'clock in the afternoon with a safety vest and steel-tip boots. And he went with his mother to Walmart that morning. He bought the safety vest, bought the steel-tip shoes, got to the Bacardi, and was given a broom and essentially told to clean out the glass underneath the palletizer, which they have a big conveyor belt holding large cartons of holding bottles, presumably rum or some other Bacardi product, and things would break all the time, and the sticky liquid would get around and the boxes would stick, so bottles would fall over and break, and you see pictures of the broken glass. We actually have a video of this, and you can go on. If you Google it, you can actually find the video. And so he's asked to go in there with a broom and clean it out. Now, he probably had never heard the term lockout, tagout. He didn't know about that someone has to assure him safety. In fact, we have a picture of the palletizer, a big sign saying, "Danger, do not enter," lockout, tagout. What does that mean to him? His first day ever working, and your supervisor gives you a broom and says, "Go in there and clean this up." What would you do? Well, his first day on the job was his last day on earth. Someone turned on the conveyor belt, and he was crushed. And we see these first-day fatalities, we call them, over and over again. And we know that temporary workers are at increased risk of injury They're new, and we've known for 100 years from studies in the steel industry that people working first days on the job and first weeks on the job are greatly increased risk of injury. But also, when you're an employer and you bring in a temporary worker, you think, well, they're not going to work for me for that long, maybe for a week or two or even a month, so I'm not going to train them the same way. I'm not going to put the resources in. The law says very clearly, if you're required to train workers on safety for whatever the hazard is, you have to train all the workers there. You can't make a distinction between the staffing agency worker and your own worker. But finally, we have this bifurcation of risk where the host employer no longer cares about workers' compensation because that temporary worker is on the workers' compensation policy of the staffing agency. So where's their incentive to prevent those injuries from occurring other than OSHA coming in and giving them a citation? So all of this is really leading to an exacerbation of this problem that we're already seeing. And it isn't fair to those employers who are doing the right thing. There are plenty of high-road employers who get this, who want to make sure that every worker on their work site is safe. And they make the investment in training, they make the investment in equipment, they make sure people have the right to stop a job when they need to. Why should these employers be at a financial disadvantage competing with low-road, scofflaw employers? But that's what we see. We see employers who think that they could get away with this, and they do. And this failure of many employers to do the right thing leads to these millions of injuries a year. And we have to prevent them. And that's the only, we can talk about their costs, and we can talk about improving the workers' compensation system and getting better benefits, and we should obviously do that. But the most important thing is to prevent these injuries from occurring. There's no reason for them to occur. But I want to talk about this. We talk a lot about these statistics. And Dr. Irving Selikoff, who was the father of sort of the asbestos, studies of the asbestos workers' unions in New York and in the country, and really, he was the one who taught us so much about asbestos and lung cancer and mesothelioma. After giving statistics, as I did, he would say, statistics are people with the tears washed away. And we have to remember who everybody is. So in our report, we included a letter from a woman whose, her name is Jessica, I'm not going to use her last name, who wrote a letter to President Obama. She was really at wit's end and wanted some help. And she described how her life and the life of her 3 children were dramatically changed by workplace injury. Her husband, Robert, worked for a Virginian employer that manufactured foam insulation. As often happened, the grinder got clogged up. His job was to go up on a big piece of foam and go and get the stuff that had clogged it up out so they could run it again. He climbed on top. His manager turned on the machine. His one foot was mangled and the other was broken. So Jessica wrote to the president, "My husband has had 4 surgeries on that right foot as undergoing physical therapy. He wears a cam boot to aid him in walking, and he's unable to walk without it. He lives in constant chronic pain every day of the week, and he tosses and turns throughout the night. As soon as he wakes up in the morning, he has to put on his boot in order to do anything. The boot stays on his foot all day long because he is unable to walk without it. Before being injured, my husband played basketball or football every single day. He ran and played outside with our 2 toddler sons. He was a weightlifter and a fisherman and a hunter, things he no longer can partake in due to his injuries from work. One of our sons took off toward the road, running full speed one day, and I was 7 months pregnant. All my husband could do was yell at me and watch from his wheelchair as I scurried as fast as possible to grab my son before he went into the road." And the injury, they could no longer afford a house they were saving for. They moved into a shelter, eventually into an apartment they called mold-ridden and infested with fleas. And so she ended her letter to President Obama with a plea. "We wish to have answers why there are so many laws in Virginia to protect the employers. When in cases like this, if the employer had done their job enforcing OSHA regulations, accidents like the one my husband was involved in would never have happened." Well, Jessica's right. Robert's injuries should never have happened. Like every workplace injury, it could have been prevented, and that's why we're here, how we commit ourselves at OSHA to helping employers And that's what the law is, helping employers prevent injuries before they occur. So one thing we've done, we've tried to change the way we do business at OSHA, is looking at ways we could get in there earlier to workplaces. And too many times we go in after a fatality and we find out that this was the second or third or fourth major event in that workplace. And previously a worker had been hospitalized or had a finger or a hand cut off. Those are red flags, and we felt we needed to address them. So we issued a regulation that went into effect in January, requiring that all employers have to now report to us when a worker is hospitalized or when they have a piece of their body cut off, when they have an amputation or loss of an eye. So since January, we've already received 3,600 reports. And that actually is a tiny portion of the hospitalizations and amputations that are occurring in the United States today. And what we're doing is trying to interact and engage with employers differently. We're not doing more inspections. You know, we have a fabulous staff. And we can do, if we work very hard, about 40,000 inspections a year. But there are somewhere between 7 and 8 million establishments in the United States today. So 40,000 isn't very many. And now we're getting these reports, and we could get 20,000 of these reports by the end of the year, and that's still a small fraction of them. But what we're trying to do is engage with employers we never had interaction with before, and that's happening. We're hearing from employers that aren't on any of our lists after, unfortunately, a worker has lost a piece of a finger or a hand or more, or they've been hospitalized. And in some cases, we're inspecting. But for every one of those employers who we don't inspect, where there's clearly a hazard, we ask them to do an incident investigation, to actually look for the root causes. Too often, we say, what happened? What was the problem? They said, well, the worker was careless, and they put their hand in the machine. And that, we make very clear, is not a valid excuse. All of us are human. They're essentially saying, a worker is putting their hand in the machine that you removed the guard from, or that you did something that allowed that to happen. We have to build our systems, and that's what the law says, that workers can't be at risk. If you have a punch press or a machine with a saw and there's no guard, of course workers are going to hurt their hands at some point. That's what happens. And so we're investigating them, we're asking them to do the root cause investigation, and rather than blame a careless worker, find out the underlying causes and change them. We're hoping that what this does is gets employers on what the National Safety Council calls the journey to safety. We meet with employers all the time who get it, who are absolutely committed to safety. And we ask, well, how did you get this commitment? And it's too often, it's after one of their workers was killed, or one of their workers had a terrible injury. And those employers now become great employers, and they understand safety and health, and they make a great commitment to it. But that's too late. So we're trying to get employers on that journey a little earlier, because right now a lot of employers think that they have a safety program, and they don't know what it's called. We call it luck. They haven't had the serious injury yet, but when they do, they'll do something better. But that's too late. So we need to get to employers to begin that journey earlier. One of the ways that helps, obviously, is OSHA goes in and does an inspection. We tell employers, especially in this state where you have a consultation program that really works well, and I think this whole table, if you haven't met them, are employees of the state of Ohio, the Workers' Compensation Bureau, and they do free inspections for small businesses. So rather than have OSHA come in and do an inspection and issue citations, an employer can just call the Bureau of Workers' Compensation and get a free inspection and abate hazards before workers hurt or before we get there. We also are just announcing today, and I'm really proud to bring it, our new poster. You know, the OSHA law says OSHA can produce a poster, and every employer has to put it up in their workplace. So we have a new poster that is coming out today. Job safety and health, it's the law. It requires, it tells employers essentially what they have to do, which is provide a safe workplace. It tells workers they have the right to a safe workplace. It reminds employers they have to contact us if there's a fatality or an injury, hospitalization or an amputation. But also makes very clear that workers have the right to raise concerns about safety. And that's really the last thing I want to talk about today, which is that it's very clear that we can't be in every workplace we need to be in. You know, we have this, as I said, a small but mighty staff. Workers see hazards. They see what's going on. They are the eyes and ears of safety. and they have to feel confident that they can raise their voice, that they can raise their concern without fear of retaliation. And we see over and over again workers being retaliated against because they've raised a concern with their employer or with OSHA. That's against the law. And so the poster makes very clear what the law is, which is a worker has the right to raise concerns, and that includes reporting an injury. And if a worker is injured and they report it, we've seen many cases where workers have been told, if you report that injury, you'll get fired. Well, that's against the law. So we tell workers, if that happens, contact us as soon as you can. The law, unfortunately, requires the notification of OSHA within 30 days of the discrimination, of the retaliation. So they have to hurry. But if a worker is retaliated against, if a worker calls OSHA and then gets fired or gets given a job which they don't want or put in a different area, workers should call us and we will get there. And we will do everything we can to protect them. And that's in this poster as well. So we think that's a really important message to get out. And we'll be asking employers if they don't have this poster to put up, they don't have to replace their old poster. But as they put up new posters, this is the new poster to put up. The last thing worth saying here, though, is that for many employers who get on this journey, they realize that, in fact, running a safe workplace, managing for safety, is more than just good for their employees. It's good for their business. We can see very clearly that well-managed companies, they're managed for safely, are more productive, they're more profitable, they're seen more favorably by investors. And what's fascinating to me, and I was talking about this earlier with the folks from the consultation program over there, is why more employers don't get it. Because once you realize what the true costs, even when employers only pick up some of the costs of workplace injuries, when they have to replace a skilled worker, and they've got to deal with those issues, it costs them a lot of money. When they have to deal with the production costs that are impacted by an injury. If you manage well, you can be more profitable and safer. And the best example of this is Alcoa, I think. And Alcoa is really the example I like to point at because it was so, it's such a powerful example. You know, many of you remember Paul O'Neill was the 72nd Treasury Secretary appointed by George W. Bush in 2009 to one of the most important posts in the country. Before that, he was the CEO of Alcoa. Now, Alcoa does extremely hazardous work. You know, go into their plants, they're pouring molten aluminum, you know, molding it into shapes that can be used in different industries. The first time Paul had a meeting with his shareholder representatives, they asked him what's his plan to increase shareholder value and things like that. He said, what I'm going to do is make this the safest place to work. And that really surprised everybody. They'd never heard a CEO say that. He knew that by committing 100% to safety, saying that safety isn't a priority at Alcoa, safety is a precondition. Safety is what we do. Safety doesn't have a budget because everything we do has to be safety. He gave rank-and-file workers all over the country his home phone and said, if you have a problem and they're not dealing with it at your workplace, call me. And that happened once or twice, and that never had to happen again. And if you look at the Alcoa website, the first thing you see in the top left-hand corner, it says safety. You click on that, it has their injury rate for the whole world in real time, updated every half an hour. And it is tiny. It's a minuscule portion of private industry. But along with that, Paul O'Neill made Alcoa one of the most profitable companies in the country, and shareholder value went through the roof. That's because they managed better. They made a better product. All the problems of production could be addressed much more easily, and it was a huge success. And there are a lot of companies recognize that now. I recently spoke on a big conference with the senior vice president of ExxonMobil, and you know, they started on this journey after the terrible Valdez incident in Alaska, and they feel the same way, that they don't budget for safety anymore. Safety is what they do. And while they've had some bumps in the road, they're also a much safer company and an extremely profitable one. So one of our jobs is to show companies not only is this the right thing to do for workers, but it's the right thing to do for themselves as well. And so OSHA is eager to help. We still will do inspections and issue citations because we think that gets everyone's attention. But we know that employers, if they do the right thing, they will be better off, their workers will be better off, and the country will be better off. So thank you all so much, and I'm happy to take a few questions.
Thank you, Dr. Michaels. I'm Stephanie Jansky, Director of Programming at the City Club of Cleveland. Today, we are enjoying a forum featuring Dr. David Michaels, Assistant Secretary for Occupational Safety and Health. We encourage you to formulate your questions for the speaker now and remind you that your questions should be brief and to the point and actually questions. Be sure to tune in to our Friday forums on 90.3 WCPN, WVIZ PBS, 104.9 WCLV Idea Stream, or one of the many other radio stations across the region and country that carry City Club programs. Television broadcasts of the City Club are made possible by Cleveland State University and PNC. Please join us this Friday, May 1st, for our annual Law Day Forum featuring Thomas Mesereau Jr., founder of the Mesereau Free Clinic. For more information about our upcoming and past forums, please visit us online at cityclub.org. Today we welcome guests at tables hosted by the Building Laborers Union Local 310, COSI, the Mid-America OSHA Education Center, Northeast Ohio Safety Council, North Shore AFL-CIO, the Ohio Bureau of Workers' Compensation, Ohio-Kentucky Administrative District Council of Bricklayers and Allied Craft Workers, the Painters and Allied Trades District Council No. 6, Safety Controls Technology, and the UFCW Local 880. We thank all of you for being here and for your support. Now we'd like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphones today are Content Associate Teddy Eisenberg and Marketing and Outreach Specialist Kirsten Pianka. May we have the first question, please?
Hi, Dr. Michaels, Tim Berga with the Ohio AFL-CIO. Thank you for being here on such an important day. It really helps to raise the awareness of safety. Two quick points. First point, the Bureau of Workers' Compensation here, very well run. We work very closely with them on safety programs. And the reason that we believe they're so well run is they're 100% publicly run. Only 2 states in the nation can say that. The other thing is the 2 examples you had mentioned of workplace injuries. Both happened, one in Texas, one in Virginia, both right-to-work states. Now, we know workplace injuries happen everywhere, but we also know that workplace fatalities are 37% higher in so-called right-to-work states. Now, my question, the Obama administration has put funding back in from the Bush cuts on OSHA and Mine Safety and Health Administration funding. You have a great team here in Ohio, but we're desperately short of inspectors. And I know the Obama administration is trying to increase funding significantly during this fiscal year budget period, and he's meeting great resistance, as I understand it, from the Republican-controlled Congress. What can you tell us about funding levels and what we should expect for increased level of inspection? Thank you.
Thank you very much, President Bergen, and thank you for your great work. And I agree with you. The fact that the Ohio Workers' Compensation System is a plan that is run by the state and doesn't have carriers, I think really does make a big difference. And the only other one like that is Washington State, which is another really terrific program that we look at both these states as important allies. The President's budget presented to Congress asks for an increase in inspectors and financial support for both workplace safety inspectors and also whistleblower protection inspectors. I wish I could predict what Congress will do. It's never easy to do that, but we certainly are asking for more inspectors. The rate right now, we can inspect every workplace in the United States once every 100 or so years. And that's simply wrong. Something else that's very significant in the budget that President Obama gave to Congress, this also asked for Congress to change the level of fines that OSHA is able to issue. Right now, for a serious violation, the maximum fine that OSHA can issue is a $7,000 penalty. And we always reduce that penalty for small employers, and if we've never been there before, there's no history with OSHA and good faith. So we have fatalities where we've inspected and a worker has died, and we'll issue a fine of a few $1,000s. And it's very painful for me to talk to the family members of these deceased workers and explain, well, that's all the law allows us to do. And that's not a statement about the value of your loved one, but the law, the penalties are very low for these serious violations. So President Obama has asked Congress to allow us to raise our fines, and we hope that will be considered. We think that will make a big difference in encouraging employers to do the right thing, because we know that employers, when they hear about us issuing fines, especially if we can get to a large fine, because we see many, many, many very serious violations, and we've had that over and over again in some large companies that you all have heard of, I'm sure, where we issue a willful citation for $70,000, and sometimes many of those. When employers read about other employers getting large fines, it wakes them up. It says, well, maybe I should do something to avoid this. And we like that. That's exactly the reason for that. So we're hoping that Congress addresses these budget questions positively, but we'll have to see.
I have. Recently in northeastern Ohio, there was a serious construction accident in which 2 workers were killed, construction workers, when a boom collapsed and fell, crushing both of them and killing them instantly. One of those workers was a high school basketball teammate of mine. Your agency investigated the accident, issued 4 citations against the employer of the 2 employees that were killed. They found that the company had not adequately performed pre-shift inspections, monthly inspections. In fact, your investigating compliance officer actually found evidence that the inspections had been falsified. Then in December, many of us were shocked to learn that the agency voluntarily, the area director, had vacated these citations against this particular employer. That is, no penalties were implemented, no strings attached. The entire citations were thrown out. This has obviously been of concern to many of us in the Cleveland community. My question, however, Dr. Michaels, is actually, do you see a problem with consistency or lack of consistency in enforcement with the agency throughout the United States? And if so, what are you doing to address it?
You raise a very important question. I don't know any of the particulars of that case, but I do know that often after we finish a case, for various reasons, we end up reducing the penalties, sometimes in negotiation to get something better, to get the employer to make a better commitment, or in some cases if we find there are holes in our case and we can't pursue them. And so I don't know in that case. But consistency is something that we care deeply about. We have 90 offices around the country, including our regional offices and then all the area offices. And so it's very important that we take the same approach in every one of these offices, because we're dealing with one country, and certainly we don't want to treat different regions differently, different areas, different companies differently. And so we work very hard at that, but I think we always have farther to go. I've been quite pleased with our progress in this area, and we have all sorts of mechanisms to make sure we're being consistent. There are always going to be cases which raise questions, and obviously we need to look at that, but I think consistency is something we care deeply about.
Unlikely interruption, but we actually just received word that there's a proclamation that was just given a few moments ago, and someone introduced Rob Medlock, who is going to deliver that proclamation from the City of Cleveland and the Cuyahoga County Executive's Office. Mr. Medlock?
Please.
We will return to the questions immediately after this proclamation.
If I could be joined by Howard Eberts at this time on the podium. Good afternoon, everyone. Can you hear me okay? Thank you. It's good to see you all. Dr. Michaels, thank you for sharing your day with us. We have a first with regards to a proclamation, and as a former OSHA director and citizen and resident of Cuyahoga County, I'm honored to present this proclamation. On behalf of Armin Budish, the county executive of Cuyahoga County, takes profound pride in proclaiming April 28th as Workers' Memorial Day in recognition of workers killed, injured, and disabled on the job. Thank you.
Thanks, Rob. Thanks, Dr. Michaels, for coming up, too. We really appreciate it. I'm not a member of the city or an employee of the city of Cleveland, but I'm very proud to represent a proclamation issued by Mayor Frank Jackson, and I won't go through all the whereas and the whereases, but now, therefore, I, Frank Jackson, the 56th mayor of the city of Cleveland, do hereby offer this proclamation designating April 28, 2015 as Workers' Memorial Day in Cleveland. So I'm very happy to see the support of the city and the county in this. Thank you.
But I will take a few more questions.
Dr. Michaels, Kelly Baker with Safety Controls Technology. As you mentioned, it's very difficult to track workplace illnesses because it's not part of the medical record. What do you think would be the best way to address that going forward so we get an accurate idea of what people are facing on the job?
Again, a very good question. It's difficult. We would like primary care physicians, hospitals to be more aware of work-related illnesses. But right now, the biggest challenge we face is actually preventing these illnesses from occurring. You know, the OSHA has permissible exposure limits, which are used by employers to control chemicals in the workplace. Our permissible exposure limits are outrageously out of date. You know, the OSHA law went into effect in 1971. OSHA was given 2 years to adopt industry consensus standards, industry limits for chemical exposures. And OSHA did that for about 500 chemicals in 1972. Some of those were out of date in 1972, but some of them were not. It's now 43 years later, and OSHA has updated or issued new ones for 30. So 95% of OSHA standards date from the late 1960s, and some of them were out of date then. So we have very old standards, and we know that they're really inadequate. Hexane, for example, which is a solvent that's often used in sort of glue products, rubber products. Our standard for hexane is 500 parts per million. Other agencies and some private sector recommend a exposure level below 50 parts per million, or 1/10 of our standard. Now, there have been outbreaks of illness, of symptoms, below 500 parts per million, yet we say 500 parts per million is legal. We don't say it's safe, but it's legal. We can't issue citations below 500 parts per million. So we're facing this problem right now is we don't think that OSHA standards are adequately protective to prevent workplace injuries, illnesses from occurring in the future. So we have an initiative on now where we've asked stakeholders to help us. How can we get away from the chemical by chemical standard to a new system where workers are actually better protected? You know, we've had a couple of situations where we've issued a standard, like for methylene chloride, another solvent, and because we have a good standard for methylene chloride, some employers move to a different chemical, which we don't have a standard for, 1-bromopropane, and which also is associated with neurological illness. And in our current system, it takes us years to issue a new standard. We can do a couple a year if we're lucky. So we call this regulatory whack-a-mole. We issue a standard for one chemical, and some employers shift to a different chemical, which they don't have to protect workers from. It's really one of the great inadequacies of our law, and we're hoping we can find a way to address that. So if people have ideas, we have some suggestions that are on our website. We're trying to have a public dialogue. If you go to regulations.gov and you look for OSHA's request for information around chemical PELs, permissible exposure limits, and look at some of the things we're talking about, it would be great. And that would be really helpful to help us prevent these illnesses from occurring. Hopefully we won't have to track them as much as a result. So thanks.
I have 3 really quick questions. Sorry, I know that's against the rules, but we seem to be running out of questions. My first quick question is there a statute of limitations on how long past someone working at a particular place that their illness can be considered coming from the job? You understand my question?
Yes.
Okay. And the second one is, I taught school for 40 years, And we worked in some pretty hazardous conditions. When you look at the age of some of these buildings and, you know, loose steps and so forth. Are teachers, that union, covered under the OSHA rules? So if teachers were asking for something to be fixed or whatever, and they were being ignored, would they be able to be whistleblowers and reach out to OSHA? And because I don't know that much about it, and I'll just leave it at those two questions.
That's good. So I'd have trouble remembering the third. Okay, the first question. OSHA is interested in current exposures, and we will do everything we can to prevent future injuries and illnesses based on current exposures. If a worker was made sick because of a past exposure, that's no longer an OSHA issue. It could be a workers' compensation issue, or it could be involved in some lawsuit. But we would want to know if the exposure is going on at the present, because we can't do anything about the past, obviously. But if someone was exposed to a chemical in the past and got sick, but they think that chemical is still being used at that workplace, we'd want to know about it. Teachers, you raise an interesting point. Teachers, in general, everybody's covered by OSHA. Miners, people who work in mines, quarries, are covered by the Mine Safety and Health Administration. Workers in every other sector in the private industry are covered. You know, I tell everybody we do everything from nail guns to nail salons. And everybody has the right to a safe workplace, whether it's in a nail salon or a construction site or a hospital. However, public sector workers in many states do not have OSHA coverage. And Ohio is one of those states. The way the law was written, and this is another problem with the law, it said that federal OSHA will not cover state or municipal or county employees. Some states have their own OSHA plans. The OSHA law allows states to have their own OSHA plans as long as it's at least as effective as federal OSHA. And Indiana has one, Minnesota has one. And in those states, public sector workers have to be covered. So if you're a teacher in Minnesota, you're covered by OSHA. If you're a teacher in Ohio, you're not. Now, states have the right to have their own public sector OSHA plan. So New York, New Jersey, Connecticut cover public sector workers in a separate program, which we think is great. Maine is about to start, and Illinois has one. Ohio could do that if they want. If the people of Ohio want to make sure that all of your public sector workers, teachers, sewage treatment workers, people, road crews, prison workers, high hazard jobs. Right now they have no OSHA coverage. If the people of Ohio, the legislature of Ohio decide to do that, they could. We would provide half the money for that program. But right now, a teacher in Ohio who works in a public school does not have federal OSHA coverage, and there's no state coverage for them.
Dr. Michaels, Bill Hosevar, Great Lakes Construction Company. Thank you for coming. My question to you is this. We currently have some programs in place for contractors such as ourselves to better ourselves. Alliances, partnerships, the Voluntary Protection Program. Do you see the agency in the future focusing strictly on enforcement base and those assistance programs going, waning away, or do you see them paralleling each other in the future?
No, we see them both as very important. And the way I look at this is, if you think about this as a sort of normal distribution curve, of course I'm an epidemiologist, so I think about normal distributions. But there are some employers who have a great commitment to safety and health and who get what they need to do. And there are other employers who really have no commitment and probably should be put in jail. And somewhere in between is most employers. We have a number of tools to help those employers get on that journey to safety. The ones who are the great employers who are in VPP, who are part of our alliances in some cases, we have programs like VPP. We could pat them on the back and say they're doing a great job. For others, we have enforcement, and for others who would like to do the right thing maybe don't know how there are consultation programs. So we need all of those programs, and we can't get rid of any of them. The question is, how do we balance them, and how do we have the biggest impact? We know that enforcement moves employers into consultation, because we want to get them into consultation. And hopefully consultation gets them into the SHARP program, which is the small employer equivalent of the VPP program. And so that we really do look at this as a continuum with different tools for different types of employers. So we'll continue all these programs.
My question has to do with an office environment, and in general, there are a lot of types of offices around the country, but when you have employees who may have stress issues or mental health issues, we know that from health insurance there is a more availability for mental health coverage, for example, but where you have situations where someone might have a variety of factors relating or resulting in like a stroke or a heart attack or etc. Does OSHA have a role in trying to inspire workplace environments to care about the mental aspects and not just the acute injury factors?
OSHA certainly has a role in encouraging employers to look at the environment of their employees. And we think that that should be done in a way that follows the rubric that's really been laid out by many different agencies and international organizations and really understood that what we call safety and health management systems or injury and illness prevention programs, which involve workers to look at what their hazards are at the workplace. And if there are hazards, there's what we'll call psychosocial hazards, they're real. They could have very different sorts of outcomes, but certainly we know that fear of violence is something that's really very debilitating. And it's of great concern. So we encourage employers, with the help of all their employees, to figure out what are the hazards facing us. You may not have chemical hazards and you may not have unguarded machines, but if there are psychosocial issues, bullying, workplace violence, that should be addressed. We'd like employers to address that. They're much more difficult for us to address, though we do have a new program on workplace violence in the hospital and healthcare world and in the retail sectors, because those have very high injury rates. And workers who work in psychiatric hospitals, for example, are at greatly increased risk of violence, and that very terrible violence. And so we do have, we will actually make inspections and issue citations in those cases. But certainly, if this is of concern to employees, they should be able to raise it with their employers. They should be able to raise it without fear of retaliation. So. Okay, thank you.
Today at the City Club, we've been enjoying a forum featuring Dr. David Michaels, Assistant Secretary of Labor for Occupational Health and Safety. Thank you, Dr. Michaels. Thank you, ladies and gentlemen. This forum is now adjourned.